Well, lockdown level 1 regulations have been gazetted, but now allows for more freedom of movement and activities. Our reporter Linda Gutlekhulu is getting some reaction to the new regulations, and he joins us now from Parktown. Linda, earlier on we heard you having a conversation there with a restaurant's representative. Now, on the other hand, we know that tourism has also been equally hard hit, if not hardest hit, by COVID-19. I mean, what do you think the response and reaction would be as you talk to them right now?
Well, Tumelo, certainly there would be some level of, relief that had been expressed earlier on when we moved to an adjusted level 3, the second one that is, but now we're on level 1, and we just want to get a sense of what it means for the tourism industry, Tumelo. You remember that some of the airports had also been opened in terms of international travel, but let's get a sense of what that information trickles down to exactly in terms of the specifics. Gillian, thank you so much for joining us. Just give us a sense then, Gillian, of what this means for the tourism industry, moving from that adjusted level 3, now we're on level 1, there's curfew, and there's also, just a lift on some of the restrictions. Give us a sense of what this means for you.
Morning, Linda. Thanks very much. Look, as the tourism industry, we welcome it. We're all, of course, very happy that our rate of infections are very low. But the changes are fairly minimal for us. 1 extra hour of trading for some businesses, but many restaurants' kitchens close at 9 o'clock anyhow, but it's fine. That's a good thing. The restrictions on alcohol sales, that really doesn't affect the tourism industry that much because it was off sales that were opened up a lot more. A couple more airports open for international travel, Kruger and Lanseria. That's great. But the two challenges we're really still facing as the tourism industry are that a lot of the domestic industry is still not travelling. Yes, domestic leisure is picking up again, and I think now we're seeing that a little bit with people who didn't do their Christmas holiday because the beaches were closed and are still wanting to travel. But all the group and convention and exhibition, sporting events like the Argus and things like that can't happen. So it's great that the number for gathering went from 50 to 100. But it's actually a confidence thing more than anything else. So that will bring a few more meetings and a few more business events to happen and a few more sporting events to happen. But there's no spectators at sporting events either, which is part of the biggest element for the tourism industry. So what we need there, and what's good to see the beginnings of, is confidence, which we think will come with the vaccine. And we'd like to see the hotel and our frontline workers in the tourism industry in the first level of the next phase of the rollout of the vaccine, because that will do two things. It's great for our staff, but it will also give confidence to international travellers and domestic travellers if they know that the people they're interacting with are already vaccinated. But briefly, the biggest challenge we have as a tourism industry is that this narrative around the SA variant took legs overseas. And we have got, at the moment, I think it's about 18 countries with borders closed to South Africans. When Joe Biden got in, one of the first things he did on the 30th of January was a proclamation to say people who'd been in South Africa 14 days before couldn't ever come into couldn't come to the United States. And all of that also means their nationals can't get back without extra quarantine, without paying to go into hotels, without extra testing, or simply can't come back. They're not allowed to travel. So our international tourism industry is very depressed at the moment, and all of that together means I've only got January statistics, but January hotel occupancies were 20% compared to a normal 57%, and when you move that to Cape Town, it was 17% compared to a normal 71%. That's less than a quarter of their normal business, and on top of that in Cape Town, rates were down 36%. That's actually bleeding. And we've used the term when we talked to the Portfolio Committee last week that the industry is still in ICU. It's still very, very challenging.
I think one of the questions, because you're raising more concerns than relief here, unlike the last time we spoke, but just in terms of what can be done, particularly with what you're saying about the variant that had caused concern in many international countries, what can be done from government side? And of course, I wanted to also touch on the vaccine rollout to say, what is the appeal from the tourism industry in terms of some of these, vaccinations that are taking place?
Well, first of all, I think what we'd like to see from government together with our health authorities is some more balanced messaging about our variant. I know we've had Dr. Salim Abdul Karim did go on CNN and BBC and say you shouldn't call it the SA variant, but it's sort of too late. That cat's out of the bag. And I'm not an epidemiologist, but I do look at data and I can quote facts. So when we went up our second wave, the gradient in terms of the way we went up the curve was no steeper than the first wave. So it didn't go, our rate of infection was not worse with the second variant. Yes, we had a slightly higher epidemic, but our slightly higher epidemic was way below most second waves in other countries in terms of rate of infection per 100,000 of population. So if we can just put some of those facts in front of the governments. And to be quite honest, this would be our ambassadors who should be knocking on doors overseas and in other countries and saying, can we please lift these travel advisories on South Africa? In the US, it says do not travel to South Africa because of COVID-19 on the travel advisory. So we would love assistance and help with that messaging, a more balanced messaging, because we don't believe that our virus has, or this particular variant that we identified, which we don't want to own, is any worse than many of the others out there. And this thing, variants are the cause of the day. Vaccinations, as I mentioned, we believe that as an industry that has been probably the most heavily impacted, we'd really like to ask that we are the first in line, post the health care workers, along with a few of the other essential staff and frontline workers, to get the vaccine. And we're also, as an industry, the Tourism Business Council has put forward support funding for that to cover the costs for our staff. And we've also suggested that we would like to help in our communities. Where we're in the rural areas, we have the vehicles, we have the fridges, we could assist with vaccination rollout to the communities that are very important to us near all of our properties, particularly out in the rural areas.
All right, Gillian, a mouthful there. Thank you so much, Gillian Saunders from the Tourism Advisory Committee. But one of the things that they're raising is that there is still concern for the tourism industry, saying that, the issue of the variant that was identified initially as the South African variant is still causing problems in terms of tourism internationally. But also what they are calling for is just to be one of the few first people to be vaccinated when that rollout continues, particularly because they were one of the hardest hit industries, and they're still suffering even under the alert level 1, saying that there's more to be done, particularly from government and ambassadors in many of the countries that have restrictions against South Africa.
All right, thank you for this update. Our reporter, Lindo Guhle Qulu.